Welcome back to Health Bulletin. A new unidentified illness has emerged in the northwestern DRC, an area already struggling with severe public health and humanitarian crises. The World Health Organization reported on Wednesday that 2 clusters of cases and deaths have been recorded in Equateur province. In the first cluster, reported in January in Boloko village within the Balamba health zone, preliminary investigations point to 3 community deaths among children under 5. These young patients developed symptoms, including fever, headache, diarrhea, and fatigue, which later progressed to hemorrhage. There are reports that these children may have consumed a bat carcass prior to falling ill. And the second cluster emerged in February in Bomat village, located in the Bazankusu health zone. Here, the outbreak appears to be spreading rapidly, with nearly half of the deaths occurring within 48 hours of symptom onset, and an alarmingly high fatality rate observed. Health officials are considering several possibilities, including malaria, viral hemorrhagic fevers, food or waterborne poisoning, typhoid fever, and meningitis. However, tests have ruled out Ebola and Marburg viruses, and no epidemiological link has been established between the 2 clusters. Even late last year, the southwestern province of Congo experienced a mysterious disease later identified as severe malaria, aggravated by malnutrition, resulting in 2,774 cases and 77 deaths as of January 2025. Adding to these challenges, escalating armed conflict in North Kivu and South Kivu has worsened the humanitarian situation. Reports of looting, attacks on aid workers, and road blockages have severely disrupted relief efforts in the region. The WHO has issued an urgent call for action. Securing humanitarian access, restoring critical infrastructure, and ensuring the delivery of essential medical and food aid are now more crucial than ever. Enhanced public health surveillance is vital to prevent further deterioration of this crisis. It's also important to note that the recent freezing of USAID funding by President Trump could have a significant impact on these relief efforts. With resources already stretched thin, any reduction in aid may further hinder the response needed to contain the outbreak and support vulnerable communities. In short, the DRC is facing a serious new health threat amid ongoing conflict and resource constraints. The international community's coordinated response will be critical in mitigating this crisis. We will continue to monitor the situation closely and bring you updates as they become available. Subscribe to Health Bulletin now for the latest updates on science and health. Be the first to know about breakthroughs, outbreaks, and life-saving innovations.